Betty Bayo suddenly passed on from cancer known as leukemia, specifically acute myeloid leukemia. It's very sad. Condolences to the family. This is one of the deadliest cancers that exist. Acute myeloid leukemia. And it's very sad that most Kenyans also, when they are diagnosed with this disease, it's either it is usually late or maybe it is advanced. In fact, acute myeloid leukemia is among the top 5 fastest cancer killer diseases, and the survival rate is usually very low. Yes, there are survivors, but it is usually very low. Let's talk about acute myeloid leukemia. A few months ago, I talked about leukemias, and I talked about the types of leukemias, which are chronic and acute. And we said that chronic leukemias, they usually present very slowly. But acute leukemias, that is an example, acute myeloid leukemia, they are usually sudden. The onset of symptoms and severity is usually very sudden. And that is what happened in this case. What are the symptoms that you should watch out for? Number 1, bone pain, severe bone pain. And these bone pains are usually located in the long bones. I'm talking about the thigh bones, that is the femur. I'm talking about the tibia and fibula, which are the leg bones, and the arm bones, and then accompanied by joint pains. And these symptoms that I'm mentioning usually appear in less than a week or 2 weeks. Excessive bleeding, especially from your mouth. When you go to brush your teeth, you experience bleeding, your gums swell. Nose bleeding that lasts more than 20 minutes. Most of the time you'll find that someone can bleed for even an hour or so without stopping. That is a red flag. Look out for fevers, especially unexplained fevers. The next one, tiny red spots that usually appear on your extremities. I'm talking about your arms, your legs. They are unexplained. You'll think that you have chickenpox, but they don't rupture. So when they suddenly appear, accompanied by those other symptoms, that is a red flag. And most times you'll find that many patients are usually treated for malaria because they present with joint pains, fever, and anemia. Now they treat the symptoms which is closely associated with malaria, forgetting that this can be a sign of acute myeloid leukemia. Now, it gets more serious if these symptoms are accompanied by severe headache, nausea, vomiting, and confusion. This means that the hemorrhaging, the bleeding that you're experiencing from your gums or your nose, it's actually your brain that is bleeding. Now it is exhibiting these symptoms of severe headache, confusion, and nausea and vomiting. Then this is a red flag. And usually this is mostly during the last moments. And most times, most patients will find that even before they have been treated or they have accessed treatment, they are usually gone. It is that fast. So please, look out for these symptoms. Let's be aware of how cancer is. Cancer is dangerous. Let me tell you, cancer is not a joke. And that is how fast someone can go. One moment they are here, the next moment they are not there. And it's usually very, very sad. And this is what most Kenyans who suffer from acute myeloid leukemia go through. Majority don't make it past 1 year. That is with treatment. Without treatment, most don't make it within 2 months. It is that serious. That is how serious acute myeloid leukemia is. Let's be aware of this disease. Let's spread the awareness on this disease.